Hi everyone, I'm Rachel Koo and I'm a research assistant and student at Stanford University, and we'll talk about telehealth in this video. We are joined by Michelle Jimenez to talk more about this.
Hello, I am Michelle Jimenez, and I'm a social science researcher in the Department of Emergency Medicine at Stanford University. Thank you for having me.
A quick review of some important disclaimers. While we will talk a lot about healthcare, this video series should not be used for personal medical advice. If you are worried about your own health, please talk to your doctor who knows you and your medical needs best.
And lastly, we have no financial conflicts of interest to declare.
With the COVID-19 pandemic, to keep both patients and healthcare staff safe, many doctor's appointments are now held through telehealth. This means that you talk to your doctor from your own home through your computer or a smartphone. In this video, we will go over what telehealth is, how telehealth works, and tips for telehealth visits.
Remember, in-person healthcare options are still available to you when needed, whether that's your doctor's office or the emergency department.
Great! How does telehealth work?
Have you ever talked with your family or friends using FaceTime, WhatsApp, Skype, or Zoom? That's actually a lot like telehealth. When you have a doctor's appointment via telehealth, you use your smartphone, tablet, or computer to visit with your doctor over video. The video is on a secure line and cannot be accessed by anyone else. And just like in-person visits, everything you tell your doctor is entirely confidential between you and the healthcare team. Your doctor will still be able to address your health concerns and see what's going on.
Telehealth might seem really strange at first. Some people worry that they won't get the same care if they were to see a doctor in person, but we want to emphasize that it is an available option to get medical care.
Yes, exactly. In fact, it actually allows more patients who may not normally be able to come in person get appointments. When you use telehealth, you will still interact with a real healthcare provider. They can write prescriptions, order tests for you, and refer you to other specialists.
Okay, but how does a telehealth appointment happen? Let's start simple. Step number one, you need to see a doctor about something. So, how do you make an appointment?
To get you started, someone from your doctor's office might want to talk to you first about how you are feeling. This might be done through email, secure messaging portals, or over the phone. They will also ask you about your symptoms and if you've had contact with anyone who's tested positive for COVID-19. They will then decide whether you will be seen via telehealth or if you should see a doctor in person. Most likely, if you are mildly sick, need prescriptions refilled, or require an annual checkup, you'll be scheduled for a telehealth visit through a video call with your healthcare provider.
To make sure you have a good telehealth visit, here are some tips.
Check that you have the right equipment. Do you have access to a computer or smartphone that you can use for a 30-minute appointment? Do you have stable access to the internet? If you don't, we encourage you to make arrangements to go somewhere or visit someone where you can have access to the internet. You can also request an in-person appointment due to these technical difficulties. If you have technology or internet concerns, try outdoor spaces that commonly have public Wi-Fi, like public parks, if you can find a private space.
When you are looking for a place to have a telehealth appointment, there are a few things to keep in mind. First, try to find a place that is private so you can discuss your needs comfortably. Try to find a place with low background noise. If possible, pick a place that also has good lighting. This is especially important if you want to show your doctor something like a rash or injury.
During your appointment, try to increase the volume on your speakers and make sure you and your doctor can both clearly hear each other. You can check your sound in advance to make sure it's coming through the right speakers. And if you have headphones, use them. This will further increase your privacy so that no one overhears what your physician is saying to you.
Try to be patient. Just like in a doctor's office, previous appointments might run long and you might need to wait a little bit for yours to start. Be aware too that the call might drop. If the call drops, just enter the link again. They should be waiting for you. You can always call the office where you set up the appointment if you want to get an update or are having trouble connecting.
Remember, you can use your camera during the video visit to show your healthcare provider things like injuries, bruises, cuts, etc. The provider might ask you or a family member if you would be comfortable having them or yourself perform certain parts of the physical exam so they can better understand what might be causing your health concerns. It is always your choice who is present for any medical appointment you have. including over telehealth. We want to emphasize that if asked to have a family member assist, it is okay to say no. And don't worry, if you do need to see someone in person, your healthcare provider will make that happen.
Yes, thanks for clarifying that. You can always communicate your concerns and needs to your healthcare provider, whether that be over telehealth appointments or in person.
So, to wrap up, in this video, we chatted about telehealth. We covered what telehealth is, how telehealth works, and tips for telehealth visits. Telehealth appointments are secure medical visits performed over your phone or computer, and they can be used to address many of your medical concerns. During telehealth visits, you should find spaces with stable internet access, good lighting, low background noise, and privacy if at all possible.
And we want to emphasize that doctor's offices and emergency departments are still available for you and safe to visit if you choose to. Telehealth visits are there for your ease and accessibility.
So, with that, we want to thank you for joining us and learning about telehealth visits.